Courtney, I wanted to ask you something that, oftentimes men in our practice are referred to you after treatment has been completed. Do you think there's a role that, number one, you should be seeing some of the patients before they have interventional therapies? And number two, what and how do you intervene for the steps of sexual recovery after a man has been treated for his prostate cancer?
So, it's always good to educate your patients. As a nurse practitioner, that's one of our biggest goals. We like to educate, and especially prior to any procedures. They do see us in the office, we do see them in the hospitals, and we try to come up with an agenda for them so they know what to expect moving forward. And like what Dr. Sandberg says, expect the worst, hope for the best. We try not to give, we want realistic expectations about, the process moving forward. And one great thing about us is that we're here to talk, we're here to listen. Being a part of, what I do at Moxxi and having that ability to provide these injections, they not only, they're not medicated. So there's no medication in them. It's your own blood that's re-injected into the penis. So it's not a harmful injection at all. So to provide them before a procedure or to comply with, following up after the procedure, either way, I would say would be beneficial to the patient. It's only going to benefit them either way. And then, at the, when we see them post-op, typically it's more about compliance after too. They have to understand that it's a journey, more of a marathon, not a sprint. And then we work with them to get them to where they, feel comfortable being and feeling, as Dr. Sandberg said, like feeling like a man again, or just being comfortable in their own skin with their spouses and whatnot too.
Sounds great. Thank you.